Hello, my name is John Courtier. I was a firefighter with the South Bend, Indiana Fire Department for over 40 years before retiring this year. I started my career in 1973 working for a private ambulance firm. In that same year, I became an EMT. I'm currently still an EMT and probably am the longest running EMT in Indiana, 47 years. In 1975, I became one of the first paramedics in South Bend area. 1979, I joined the South Bend Fire Department. I worked on the ambulance for 13 years. I moved into the public education division, riding an engine and working pub ed. I then became the captain of Engine 1. From there, I moved into the instruction bureau as a captain. I was promoted to battalion chief, and when I retired, I was the assistant chief of training for the South Bend Fire Department. I retired January 2nd of this year after 40 and a half years. The reason I did this video was after I had my event, there was some questions whether this was a pre-existing injury or whether this occurred because of an on-job injury. And so I started doing some homework, and I was amazed at what I found that no one ever taught me. No one ever told me anything about this. I know for some of you, all you're going to be hearing is wah, 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 wah. I know in the back of your mind, you're saying, I'm young, this doesn't pertain to me, I'm healthy, I eat right, I exercise all the time, I pass all my physicals. Well, guess what? If you're a firefighter, this does pertain to you. You're going to be amazed how prevalent this is in the fire service. I wish somebody had talked to me years ago about this. Maybe I would have changed things and done things a little differently, and maybe my outcome would have been different. It's like years ago, I wish somebody had talked to me about PPE. We never thought anything different than going into a fire, sometimes not even with our SCBAs on. And what we're finding out today is that firefighters are dying all the time from cancer because nobody told us. Well, now we're putting an emphasis on cancer. We need to put just as much an emphasis on heart disease. There's going to be a few definitions that you're going to hear, and I just, so we don't have to keep going over them. The coronary heart disease, the CHD, cardiovascular disease, sudden cardiac death, cardiomegaly, enlarged heart, LVH, left ventricular hypertrophy, the enlargement thickening of the left ventricle. What you're going to find is what was prevalent in autopsies done on firefighters who died because of a heart attack was the majority of them either had cardiomegaly or the hypertrophy or both. Heart disease, the median age for the first heart attack of a firefighter is usually around 49 years of age. It's not saying it doesn't affect people who are younger. It does. 1% of the time we spend fighting a fire. 1% of our job is fighting a fire. And most cardiac fatalities happen 32% of that time. Every cardiac-related line of duty deaths, there's 25 non-fatal but life-altering cardiac events. There's statistics all over the place. Studies have been made all over the world on firefighters. In the United States, every 83 seconds, an American dies from a heart attack. 45% of the firefighter fatalities on line of duty are heart-related. 82% of cardiac fatalities are male firefighters, had evidence of coronary artery disease, cardiomegaly, or left ventricular hypertrophy. This might be a little small for you to see, but I think what comes out of this is the majority for firefighters, we see it's 45 years or older. Again, it's not saying it can't occur to somebody who's 20, 30 years old, but the majority of firefighters who have died in the line of duty have been over 45. The majority of them had hypertension. A lot of them had hypertension. 21% had hypertension, but the cholesterol levels, that's big. 63% had elevated cholesterol levels. The type of duty that someone was doing when they died in the line of duty. Fire suppression was number 1 and training was number 2. This slide talks about hours that you are on duty prior to having the symptoms. And for me, I can relate to this I had my symptoms roughly 4 to 7.9 hours into my shift. And so I was in the high percentage there. Let me point out that this is not an EMS class. I'm not an expert on cardiovascular system. I'm not an expert on cardiac arrest, but I do have a little experience about having a heart attack. So I feel I might be a little bit of an expert in that field. When we talk about cardiac arrest, we know that we're talking about the heart stopping. Something caused the heart to stop. Heart attack is what leads up to that cardiac arrest. One of the biggest problems and factors with a heart attack is the arteriosclerosis. You see here with a blood clot and the arteriosclerosis, a buildup in the blood vessels, or you could have the spasms. Heart attack occurs when there's a blockage of the coronary artery. As a result, the muscle begins to die. Without early medical treatment, this could be permanent. Why us? Why does this occur to us? There's trigger mechanisms for cardiovascular disease and death. We're susceptible, we're vulnerable. Some of the reasons are because of our physical demanding, the intense work that we do. We go to 0 to 100 in no time, going from a stagnant stage where we're just sitting around to within 5-10 minutes, we're busting our tail, trying to put a fire out, trying to do an extrication, trying to help somebody. Our heavy tools that we carry, that also makes us susceptible and vulnerable. In the PPE that we wear, that adds weight to us, and it also keeps us from being able to relieve some of that heat that builds up inside our body. The psychological stressful, the alarm response. It's amazing how our normal pulse could be 60, and once that alarm goes off, it goes through the ceiling. The dangers of the job. We know the dangers, and we have that usually in the back of our mind all the time. The strain, environmental hazards, the heat stress on our bodies, the stress, just the stress on our minds, the noise, dehydration, and particulate and gaseous exposures in the smoke, and how those affect us, and those can get into our bodies and cause harm to us. As firefighters, we're pushed to the limit. You can see where our heart rate starts at rest, 60 to 70. Once we're firefighting, it goes to 192. Our cardiac output, what our heart is pumping out, may be at rest 5.7, and we're going 5 times that when we're firefighting. The same with our oxygen consumption, what our body is demanding of us and what we need when we're firefighting. You can see the strain here when you have an increase of stress, decrease of plasma volume, altered electrolytes, viscosity, coagulant. What happens is when we're in a fire, we start to dehydrate. And also when we're in a fire, because of the heat, our blood starts to thicken. It starts to coagulate. If we have any underlying problems, this will just cause more of a demand of our heart, and this can just cause the cardiac event to occur. We're wearing over 50 pounds of gear for prolonged periods. We're working in high heat, high stress. Fluid loss can result in decreased cardiac output. Our sleep patterns. This also has a bearing on our cardiac problems, is if we aren't getting the right amount of sleep. 3 hours of prolonged firefighter stiffens the arteries and impairs our heart function. After 18 minutes of strenuous firefighting drills or work, our plasma volume is decreased, and it contributes to the stroke volume and leads to thickened blood, which again can lead to plaque formation, which can lead to blockage of our arteries. Hyperthermia, dehydration, the cardiac strain. We're losing fluid because we're in a heated environment and we're covered up. We aren't allowing any of that heat to escape. We're dehydrating. 18 to 20 minutes of firefighting leads to 1.5 to 2.5 body temperature change. Our body is increasing. The temperature is increasing. And what research has concluded that exposure to extreme heat during firefighter increases the tendency for clot formation, impaired blood vessel function, and reduction of function to the heart muscle. Extreme temperature blood was 65% more likely to form harmful clots after fire stimulations. It's kind of ironic that I'm recording this on May 14th, 2020. May 14th, 2019 is a day I'll never forget. It's a day that changed my life forever. It's a day I wish I could go back and do things much differently that day and days before. First off, let's go over my medical history. I had a family history where my father passed away at the age of 61. My father was as healthy as could be. He maybe saw a doctor occasionally, wasn't on any kind of medicine, had no cardiac problems whatsoever that we knew of. He was in the Navy for over 40 years, had a naval physical, which was very thorough every year, passed that with flying colors. On December 18th, 1988, I received a call in the morning from my mom. She said that my dad was sick. The ambulance was taking him in. I met him in the hospital. When they brought him into the ER, he looked at me. He said, "Johnny, this hurts so bad." My dad never complained of anything. Within an hour, my dad had passed away in the ER, and more than likely it was from an MI. I have a history of high blood pressure. It's controlled with medicine. I've never had any problems with that. I have a propensity to have kidney stones. I've had a number of surgery for kidney stones. I have a large kidney stone still in my left kidney, which someday will decide it's time to come out. I have yearly physicals with the fire department. I pass those without any problems. All my blood works come back. We do a treadmill test and everything has come back fine with that. Warning signs, now that I look back, yeah, there was some big warning signs. I completely ignored them. A couple weeks prior to my incident, I work out every day. I was working out at work every day using a treadmill or elliptical, depending on the day of the week. And what I noticed about 2 weeks before my incident was when I would do my workout on the treadmill, I could only go about 10, maybe 15 minutes before I'd have this cramping feeling in my stomach. I attribute it to the fact that I was trying that keto diet. And that's why I was attributing it to. I would get off the treadmill, go over on the finish out my workout on the elliptical, no problems. But that should have rang a bell. That should have made the light bulb go off in my head, but it didn't. That was a warning sign that I completely ignored. On this day, we were doing training with our recruits at the Clay Fire Territory Training Facility. We're going to do a number of live burns with them. These are pictures from that day. As you can see, I'm in the middle and I don't really look sick. I don't feel bad at all. I was getting ready to observe the recruits going into some live fire situations. I got there about 10:30 and they were getting ready to do their second burn. And so I decided to stay outside and just observe them from the outside. After that, we broke for lunch, came back, and we're getting ready to do 2 more burns. I wanted to go inside with them for those burns. I put on my full PPE with SCBA, and we did the 2 burns. The first burn, I was up on the 3rd floor where we were doing the burn, and it got very hot in there. A couple times we had to get down low. But we were in there maybe 15 minutes, maybe 20 minutes. Came out, took a break. I don't remember if I drank water. I'm not one that drinks a lot of water, so I don't remember whether I did or not. But I felt fine, no problems at all. We took a break and got ready to do another burn. So we're doing the final burn of the day. The container had heated up because of that, but because we take breaks in between, that temperature had come down. So when we were doing the 4th burn of the day, I was again on the 3rd floor observing the firefighters coming in and doing some search and rescue and doing some fire tactics. Again, it got very hot up there. I had to get down a couple times to blow the fire. But again, I wasn't experiencing any problems whatsoever. After the final burn, after rehab, the recruits were starting to pick up. I doffed all my gear, and I may have taken something to drink. To tell you the truth, I don't think I did. I wasn't feeling well. I wasn't feeling right. I wasn't having any chest pains or anything. I just wasn't feeling right. And I thought, okay, I'm dehydrated. That's the whole thing. I'm dehydrated. I just need to start putting fluids in me. But since it was the end of the day, I decided I'm going to get in my car and drive home. And I had about, from there, a 20-minute drive to get home. I thought, I'll just go home. On my way home, I was really starting to ache all over. I wasn't having any chest pain. I was having aching all over my body. I couldn't get comfortable driving. I can recall as I was driving down a road called Buckeye Road, between Douglas and Day Road. On the right side, there's kind of a culvert that leads in the woods. And I was thinking to myself, this is where they're going to find me. This is exactly where they're going to find me. Again, I was dehydrated. I wasn't having a heart attack because I had no history of any heart problems, any heart conditions. And so I went home. I made it home. I just started pouring in the fluids. I just started. But I was aching all over from my toes to the tip of my head. I was aching all over my body. And so I started taking in a lot of fluids when I got home, Gatorade, water, anything I could find. I jumped in the bathtub. Why? I have no idea. I got out and I sat in the chair and I thought, okay, once this is over, I'll be fine. And it started to subside a little bit. And so I felt that, okay, it is dehydration. And I called my wife and said I wasn't feeling well. She said, well, maybe we ought to go to the hospital. I said, I'll wait till you get home. And all I remember is sitting in the chair thinking, I got to go and cut grass. I was leaving for 2 days, and 2 days to go to Colorado. I had to cut the grass. And I thought, once I feel better, I'm going to cut the grass. But I never felt 100%. Some of that aching feeling went away, but I still was aching and it didn't go away. By the time my wife came home, she walked in the door and she said, you look like crap. I'm going to call you an ambulance. And I insisted, no, don't call an ambulance. It's only dehydration. And I was worried, to go to the hospital just for dehydration. But then I agreed, okay, let's go, but you're going to drive me. Well, she was almost insistent on her calling an ambulance. But again, I said no. So we're driving to the hospital, and on the way, I'm starting to get some pain. I'm starting to get some pain in my chest. I'm not saying too much about it, but I'm starting to feel a little bit of pain. I'm thinking, well, maybe we ought to stop and call an ambulance or have an ambulance meet us. I'm thinking, this is the quickest. We're going to get there quick. Remember, I'm in denial. It's dehydration. It's not a heart attack. We finally get to the ER, walk in, and naturally there's that person in front of you that's had an earache for 3 weeks and staying there in his pajamas, and he's telling his life story. And the clerk looks back at me and says, are you okay? And I said, well, I'm having some chest pains. And she looks at me like, yeah, all right. Like I was saying it just so I could pass this person in front of me. Well, they take me back to the triage room. And in the triage room, the nurse, she says, on a scale of 1 to 10, what's your pain? And I said, well, it's about a 9 or a 10. And at that point, I looked at my wife, and she looked at me, and she said, you could just see in her face, you dumbass, why did we not call an ambulance? So she runs an EKG. This is what my EKG looked like. This is my EKG. It just so happened, I probably would have forgotten everything that I learned in paramedic school. It had been so long ago. But for EMT class, to maintain my certification, I had to go through some classes. And one of the classes I went through was on STEMIs. And it just so happened when this came out of the EKG machine, I knew exactly what was going on. I knew it wasn't good. So then immediately they rushed me into the ER. And it was a whirlwind in there. There were people all over me. I can't remember half the things that was going on. I just remember that they were trying to start IVs on me, but because of the fact that I was probably dehydrated, they were having a hard time getting IVs in me. I was lucky enough that the cardiac cath team was in hospital. They came down, they looked at me, and they said, let's go and get him out of here. And my wife kind of recalls the fact that they were running down the hallway with me. I don't remember a lot of that. Things were just, like I said, in a whirlwind. They got me up into the cardiac cath lab, and what did they find? They found that I had the widowmaker. I had a complete 100% blockage of my LAD. The LAD is one of the largest arteries of the heart, the left anterior descending artery. I had 100% blockage of my LAD. They inserted 2 stents, and then my artery opened up. What I had was one of the most deadly heart attacks you can have. Survival rate is 0 if no cardiac intervention. 5% survival rate after cardiac arrest. Must be seen within 2 hours. I was told while they were doing the cardiac cath that I went into VFib, but I came back on my own on that. There are no signs that are going to tell you heart attack's going to happen, get ready for it. You have to know the signs. You have to be prepared for it. There's factors, and these are factors we have to look at. You have to look at your age, your gender, your family history, your race, whether you're overweight or obese, poor dietary choices, your lack of regular exercise, tobacco use, or extreme alcohol use. For age, I was 64 years old. Okay, I'm right there in the factor. And gender, male, which has a higher propensity to have heart attacks. My family history, which I did have. My race, a Caucasian, which also plays a factor into that. Overweight or obese, they go by the BMI, which I think is pure bull. But I was about 220 pounds, which according to the BMI, I was obese. My dietary choices, I thought they were pretty good. I really didn't do a lot of bad eating. I did regular exercises. I was exercising 4 to 5 times a week. No tobacco use, and moderate alcohol use, a little bourbon here and there. So we have to look at ourselves. Some non-modifiable risk factors for us is the age, heredity, race, and gender. But there are major modifiable factors that we can do something about. Cigarette smoking, hypertension, high cholesterol, obesity, diabetes, and physical inactivities. These are all things that you can do something about. There's signs and symptoms you have to look for. The chest discomfort, spraying to the neck. We had another firefighter who, about 6 months after my episode, probably if you're to pick one of the top 5 fit firefighters on the South Bend Fire Department, he would be absolutely one of those. And younger, in his early 40s, and he had a cardiac incident. And he didn't have the typical symptoms that we all know about. The symptom he had was for a number of mornings, about 2 o'clock, he was woken up with some sharp pain on his right arm. He went into the hospital finally after, again, a case of denial, and found out he did have some cardiac problems, which they were able to, through medication, take care of. Discomfort in the upper body, difficulty breathing, nauseous, vomiting. I didn't mention, but when I did come home, I vomited. Bing, that's one of the signs and symptoms. I ignored it. I was in denial. Cold sweat, I didn't have it. Could start as a mild pain, discomfort, squeezing in the chest, and the feeling of impending doom. Remember earlier I told you I thought I was going to end up on the side of the road, and that's where they were going to find me. It's something that is a sign and a symptom. The whole thing is, if you are not feeling right, if You can't explain after you've been in a fire, after you've been in a training incident, if you cannot explain why you aren't feeling the way you do, get it checked out. If you aren't feeling well, get it checked out. Watch for signs. Women have a few different signs than men, but a lot of the signs go hand in hand. That elephant sitting on your chest. Yes, it does. It feels like an elephant sitting on your chest. When I said I had that pain threshold at around a 9 or 10, that was because that elephant was sitting on my chest. You got to be honest about your symptoms and whether it's something you have experienced before, like the flu, or it's something different. This potentially warrants a trip to the hospital. The International Association of Fire Chiefs has started a directive this year in 2020 that if you don't feel well, don't make it your farewell. If you aren't feeling right, if something isn't right, get it checked out. You've got to stay in shape. We know we have firefighters who are obese, who are overweight. You can look to your right, look to your left, don't do it. They know who they are. Those are people that we have to help, that we have to look after. So what can you do? You can change your diet. That's one thing that I did. I changed my diet. More fiber, less salt. Salt's a big factor, especially with hypertension. One of the things that I had to do was go on a very restrictive 2,000 milligram salt diet a day. And that's not much. 2,000 milligrams is not much. So I eat differently. I don't put salt, and I never really did put salt on a lot of things, but I don't definitely now, especially when I'm cooking. I don't use salt. I use salt substitutes. Eat potato chips, salt-free. They taste like crap, but what the heck. Lose weight. Since my incident, I've lost over 20 pounds, but I want to lose another 15. It's tough. I know it's tough. But if you are overweight, if you're in that obese section, you've got to lose some weight. Exercise more. Just getting out and doing something is better than sitting around all day. I'm trying to exercise as much as I can, and you can too. But it has to start with you. You have to make that decision. Get up out of that chair, walk once around the station. That's more than you've done maybe the whole week. Walk twice the next day, walk 3 times. Work out together. That's one thing that as recruits, when we start firefighters out, recruits at the South Bend Fire Academy, every morning they work out for an hour. And what we found is that these firefighters carry this on into their career. And they're working out every day that they're on duty, and they're working out when they're off duty. But it's something that if you are stagnant, if you are not an exerciser, start simple, start small. Go for a walk around the block, go for a walk around the station, go walk around the room. Stop smoking. I know that's easier said than done. You may have been smoking for the last 20 years, and just to cut it off is very hard to do. But it's something that's going to be healthy for you. You know that, but you know that it is a cardiac risk factor. Reduce your alcohol usage. If you binge drink constantly, you've got to cut that down. A little bourbon here and there is okay, but you can't be binging all the time. At fires, you've got to hydrate. You've got to hydrate before you go to the fire. You've got to hydrate during the fire. You've got to hydrate after the fire. Remember, when your body starts to lose fluid, your blood starts to thicken. Your blood starts to coagulate. Your blood can cause clots. Your blood can cause a cardiac arrest. So what you've got to do is you've got to constantly be hydrating. You've got to take the rehab breaks. Not just the rehab breaks where you sit down, take a little drink, change your tank, and go back in. You've got to bring that core body temperature down, because remember, it's building up that heat inside your body. If you're doing nothing to bring that temperature down, all you're doing is causing cardiac problems. You've got to bring that core temperature down. Now, those cooling chairs were ideal. that some departments use because they do bring your body temperature down. What you're going to probably find in the future is, our SOP was that we go into a fire, we come out, do a quick rehab, change tanks, go back in. After the second tank, then you do a full rehab. I think you're going to find in the future that we're rehabbing after one tank. I know it's a case of manpower, but we've got to do something because of the cardiac problems. We've got to bring down that heat that our body's building up. We've got to stop that dehydration. We got to monitor our vitals at rehab. One thing that we've instituted with the South Bend Fire Department now is when we're doing live fire burns, we do vitals before the burn, we're doing vitals during every rehab break, and then we're doing vitals at the end of the day of the burns. I wish we had done that when I had my incident. I could have walked 20 feet to the fire station and had the medics look at me. But again, I was in denial. But by checking vitals constantly, maybe we're going to pick up on something like that. Limit the times in the heated environments. Only go in for maybe one tank. It's a manpower thing, but we may have to be calling more units to the scene just for this. Live burn SOP, I just mentioned how we've changed ours. And yearly checkups and WPEs. That's the wellness, the fitness programs that you can have. We had a yearly checkup. I passed it every year, and it's good. It's good to have a yearly checkup for the fire departments. If you don't have one, I highly suggest it. And I'm going to suggest in a few minutes some other things that you can add to that. The physicals, exercises that we do is where we put firefighters through kind of a modified CPAT. And this was developed by Public Safety Medical out of Indianapolis. And we do this yearly, where our firefighters have to pass this in order to continue on the job. And usually when we do this, at least 95, if not 99% of the firefighters pass it. But it is kind of a base. It starts out, it tells you whether you are in shape or not. So what's some simple things you can also do? Manage your blood pressure, control your cholesterol, reduce your blood sugar, get active, get out of that chair, eat better, lose the weight, stop the smoking. Now, when we look at this chart, this is something interesting to think about. We always hear that we spend 1/3 of our life at the fire station. Yes, we do. What if you modified your diet by 1/3? If you at the fire station, you started eating healthy, just 1/3 of your diet is healthy. Maybe that can carry over to the other 2/3. The same with exercise. If you only exercise 1/3 of the time, that's better than not exercising at all. But maybe that can carry over to the 2/3 that we're at home. But then the 2/3, it's kind of hard to modify your stress while you're at the station because we're always under stress when we're at the station. But at home, you need to be able to modify stress. Stress is a killer. Stress is a very big cause of cardiac problems. We need to be able to control our stress. The majority of times, the best place to control our stress is at home. We have to take away stress factors. When we come home from work, take that hour, that golden hour when we get home, and just relax. Let everything go away from the previous day's work. But we need to modify stress in our lives because of the occupation that we're in. Stress is a killer. You got to know your numbers. When you go to the doctor, when you have blood work done, know your numbers and know that for firefighters, things are a little different. Know your heart age. For firefighters, because of the problems we have to worry about it, especially those firefighters who are over 40 years of age. Your blood pressure, normal, we've always been taught 120 over 80. You have to watch it. Your blood pressure starts creeping up, you've got to do something about it. You've got to see a doctor. Blood sugars, again, another problem that relates to cardiac emergencies. If you have diabetes or any problems with blood sugar, have this checked and make sure that you are taking your medications. Your cholesterol level, we see that with the arteriosclerosis and how the buildup of plaque in our blood vessels is so vital, and how we have to do something to stop that. And it's by our diet, it's by weight, it's by exercising. Those are all ways that we can drop our cholesterol levels down. I told you I was going to talk about things that you could also have with your yearly physical with the fire department. And here I'm listing some things that we can add on. That exercise stress testing, which we did. But afterwards, I talked to the doctor and I said, I have a stress test. And the doctor advised me that stress test tells you if you are having a problem right then and there. It doesn't tell you future problems that you might have. And so stress testing, while it's good, it's not a tell-all. We've got to be screened for the cardiomegaly and the hypertrophy that is so prevalent amongst firefighters. That enlarged heart, that thickening of the left ventricle. We have to have tests for that. Coronary artery calcium scans can help with the plaque that's building up in us. The echocardiography and the cardiomagnetic resonance, these will tell us, and these can tell us with our valves, the cardiac output in the left ventricular mass in the walls. These can also tell us that. The C-reactive protein test is a good test that tells you your risk for developing coronary artery disease. I know these are expensive. I know these cost more, but having a heart attack costs a lot. And by having some of these tests incorporated into our yearly testings can save lives. Hydration. I mentioned it before, I'm going to mention it again. Before, during, and after, you can't hydrate enough. You've got to stay hydrated while you're working, whether it's cold out, whether it's warm out. The rehab. You've got to make sure when you're rehabbing, you are actually rehabbing. You're rehydrating, you're reducing that hyperthermia. You're bringing that core body temperature down by taking off as much gear as you can. There's a research done by the Illinois Fire Service Institute. And what they did, they looked at the firefighters who had died in the line of duty, and they looked at firefighters who had heart attacks while in the line of duty and their relation with using aspirin. What they found out was the fact that using aspirin after a heart attack really was not that significant. The significance came with using an aspirin prior to having a heart attack. We've always heard that, a baby aspirin a day is good for you. Well, yes, it is, and it does prevent some cardiac problems. But you just can't do this on your own. You have to have doctor's recommendation to do this. If your doctor has recommended for you to do this, please follow their instructions and do it. Changes. I've modified my life immensely. Bottom left, you see, I take my blood pressure daily and I weigh myself daily. And one of the reasons I weigh myself daily is the doctor has me doing that. In case I see an increase of 2 or 3 pounds, that means I may be retaining fluid, maybe a cardiac problem. I need to call them right away. My medicines, those are my medicines. I'm that old person now that has a ton of medicine. When you go to the house and you got to look through every bottle and see what they have, that's me. I have that pill box that tells you what day of the week it is and what medicine I should be taking on a day. I take 5 in the morning, 3 at night. I'm exercising. I'm continuing my exercising, trying to do it at least 5 days a week. My diet, I've changed my diet and where I've cut out the salt as much as I can. I'm trying to cut out as much red meat as I can. I'm eating more chicken, more fish, and more vegetables. This plays heavily on you. This plays heavily on your mind. You wonder, am I going to be around next week? Am I going to be around a month from now? Am I going to be around for my next birthday? You start to feel a twinge in your chest and you think, is this it? Is this the time I go? You become a little more religious. You do. You think about a lot of things about life more. The main thing I look at is that picture in the middle. Those three people there. That's why I'm making my changes. I want to make sure I'm around for them. Those are my grandchildren. My two sons, they don't remember their grandfather. Their grandfathers died when they were very young. I want my grandchildren to remember me. This is why I want to be there for everything they do. And this is why I'm making changes in my life. There's a thing called ejection fraction, and they test this after you have a heart attack. Normal is 50 to 65. I was having my ejection fraction checked. It was maybe 6 weeks after my heart attack. I was excited to go because I knew the ejection fraction when I was in the hospital was bad. I knew it was low. But I was excited because I had started medicine. I had been exercising. Once I got out of the hospital and I was cleared to exercise, I was exercising. I was losing weight, so I felt much better. So I had the test done, and my ejection fraction ended up being 35%. It hadn't increased anything from when I was in the hospital. And what this means that I am susceptible to having cardiac problems and cardiac arrhythmias. And so what the doctor put in was, he put in an ICD, an internal cardiac defibrillator, and a pacemaker. Right now, it's in mostly for being an ICD, not so much a pacemaker. But it's inserted in me, and it's bothersome. It's in my chest right here. I can feel it all the time. I can feel the wires into it. It's about the size of a mini key fob for your car. But like they say it's a rescue company in your chest. Okay, I'll go with that. I know this is hard, and I am bitter a little bit about it, and I can just say, hey, that's what I've been dealt with. But I've got some choices to make, and I'm getting better every day. And my choices are to be better tomorrow than I was today. And I do that just by maintaining that new healthy lifestyle. You risk your life to protect society. Cardiac heart disease is preventable. It's a leading cause of on-duty deaths. 45% of firefighters who die in the line of duty, on duty, is because of a cardiac event. What do we have to do? You have to get your union, your workers' comp, your pension authorities, your cities, towns, county, risk management, health and safety committees. They all have an obligation with you to work together to implement adequate medical programs for all firefighters. That's a yearly checkup, but also adding some of the items I mentioned. We've been taught from day one that if we have an unconscious patient, a patient that can't verbalize their problem, to look for medical IDs. These are probably some of the most common medical IDs you might find that we've been taught to look for on patients. Gone are the days when the medical ID was just something you wore around your neck or a bracelet that you wore. There's many different medical IDs out there now. You can have one on the cell phone. You can have one on your wristwatch. You can have all sorts of different bands on or bracelets on. Even a ring might give an indication. So if you have an unconscious patient or a patient that can't verbalize and you're looking to see if maybe they have a type of medical condition, there's all sorts of areas now that you have to start looking at. These are the medical IDs that I carry. The one on my wristwatch, I'm going to talk a little bit more about that company in a few minutes, but that tells you that on the opposite side, you take my wristwatch off, on the opposite side, you're going to see more information. On the left side are some bracelets that I might be wearing. The one states that I have cardiac implant and ICD, and on the back it has the phone number for you to call in case of emergency. On the right, is another bracelet type ID that I have that I wear at times, and this carries a QR code for you to follow. Information can be found in the patient's wallet. This is my wallet. I carry an ID card that has a QR code in it. I carry the information for my stents. I carry the information for my internal cardiac defibrillator in my wallet. Look there. One company that I think is well ahead of the curve on medical ID is this company called My ID. And I'm not a spokesman for them. They don't pay me, but they did send me some free samples. So I'm going to talk a little bit about their ID. Normally during my talk, I tell you to silence your cell phone, keep them out of sight. Well, right now, I want you all, if you have a cell phone that you can read a QR code, please grab your cell phone at this time. The MyID, I have one on my wristwatch, and you take the watch off, and on the other side, you're going to see a QR code. I also have a wrist band that I wear that's similar to this, that has, on the other side, it has the QR code for you to read. What I want you to do is I want to take your phone and scan the QR phone that you're seeing here. You may have to get close, you may have to enlarge it, but scan it. And what you're going to find is you're going to find the patient's information. And this will tell you everything about the patient. Now you're reading sample information right now, but if you were to read mine, you would have information as far as what events I had. I talk about May 14th, 2019, my cardiac episode, and I had 2 stents put in. I have also in November of 2019, I had the ICD implanted. I have a list of all my medications in there. I have emergency contacts. I also have my information for insurance, all vital. These are things you have to look for. I carry also a card in my wallet that has this QR code. Over the last hour during this presentation, 83 Americans have suffered from a heart attack. 43 Americans have died from a heart attack since we started this program today. I mentioned before that there's no signs. There's no signs that tell you to look ahead. Well, if you're looking for a sign, here's your sign. Get your heart checked. Learn your risk. Learn if you have any of these factors which could cause a cardiac episode. I survived the Widowmaker. Not a lot of people get to say this. I can. Thank you for watching this PowerPoint. I hope you found it useful. I had a great career with the South Bend Fire Department. After 40.5 years, walking away was very hard to do. I worked with a great bunch of men and women, and to this day, I still miss being with them every day. In this picture, you see the top left is a picture of me in my early years. I had to prove to people that, yes, I did have hair. The middle picture is my recruit class, and I'm the last one to retire out of that class. The top right was a command staff that I was fortunate to be a part of. Bottom left is a picture of one of my best friends, and Kevin Colbert. Chief Colbert passed away 3 years ago at the age of 58. He was off duty, as healthy as pretty much could be, always passed his physicals, but it's in his memory that I do this presentation. If you have any questions or comments, you can email me at my email here, eng1jc@comcast.net.